Okay, yes. One more. Yeah, so my name is Sanya Mathur. I am an OET trainer. I will be teaching you the subtest of reading. So just to tell you something about myself, I've been teaching for the past 5 years, and I did my master's in English literature from abroad, from Netherlands, and I've just been in love with teaching ever since. So other than that, I love dancing, I love painting, I love singing. I'm not sure if I'm good at it, but that's what I like. So if any of you ever want to talk about any of these things, you can freely call me up or drop me a text and we can discuss about these things. In addition to your doubts about reading, of course, not just about, ma'am, so I painted this today. No. Right? Let's discuss all things. Okay. I think most of the students have joined. Okay, so perhaps we can start now. So we will first discuss the format of the reading test that is there in OET, and then we will move on to the more particular parts of the lesson. So tell me this, what is the duration of the reading test of OET?
1 hour.
1 hour, ma'am.
1 hour,
Yes,
ma'am.
yes, 1 hour. Yes, everyone says 1 hour. So there are three parts, right? Part A, B, and C. So how much time is given to complete part A?
10 minutes.
15 minutes.
15
Okay, someone said 10, someone said 15.
50 minutes. 15 minutes.
15 minutes. 15 minutes.
14 minutes. So
15.
28 minutes?
15.5.
Okay. So 15 minutes are given to attempt the part A of reading. So what they do is they will give you one booklet of part A first. You have 15 minutes to attempt that, and then they will take it away. Then they will give you part B and C booklets together. Okay, so you cannot return to part A. That is very important to know. And speed is required because there are 20 questions in part A and only 15 minutes to solve that. Okay. So very quickly, what we are going to do is we will see a sample test of reading and we will discuss what kind of questions are there. Okay. So let me know when you are able to see my screen. Are you able to see my screen?
Yes.
Yes, ma'am.
Okay. So first let's talk about part A. There are 4 texts in part A. So as you can see, there is text A, then text B, text C, and text D. So there will be 4 texts in part A. Now the kind of information that is there in these texts is about illnesses, diagnostic tools, treatment options. As you can see, surgical options are there. Then before that, pharmacological interventions are there. Then something about dietary changes is mentioned. And before that, some things about obesity are mentioned, right? So these are the 4 texts that will be there in reading. Now one of these 4 texts in reading part A will be in a tabular form. So as you can see, here's a table. You can all see it, right? Yeah. Yes. So one of the 4 texts is going to be in a tabular form. It can also be pictures, it can also be graph. But remember, one of the 4 texts is going to be like this. Okay. So let's discuss the questions a little. Okay. And be very aware of what I'm discussing about the questions, because in the end, I'm going to ask you some questions about this. So we have 20 questions in part A. How many?
20
20
questions.
questions.
Yes. So the first set of questions in reading part A is called matching questions. Okay. What is it called?
Matching
Matching of
questions.
the
Yes.
question.
Very good. So in matching questions, what do they ask? They say that in which text out of the 4 texts can you find information about? So here it says specific advice to give patients about their food intake. So I will go back and I will skim through all the 4 texts and try to see that where is the information about the advice that is given. Okay. So these type of questions are called matching questions, where you have to see in which of these texts will I find information about this. Okay. It will always be the first test, first set of questions in reading part A. Is this type of question clear? What is there in matching questions?
Yes, ma'am.
Okay. If you have any questions at any moment, you can just ask me. Do not hesitate. Okay. These sessions are just so that, everything is very clear to you. So no hesitation here. Okay. The next set of questions that are there in reading part A is short answer questions. So here you can see questions are written and the answers will be very short. So just some, maybe a word, numbers, both a word or a short phrase, but it will never be like long sentences. And there is no limitation that a short phrase has to be just 4 words or just 5 words. It can be a longer phrase as well, but it will never be full sentences. Okay. So these are called, what are these kind of questions called?
Short
Short
answer
Short
question.
answer.
answer.
Short answer
Short
questions.
answer.
Yes, correct. Now the next set of questions, these are called gap filling or note completion. Okay, gap filling questions or note completion. So as you can see, there are some notes given here and there are gaps in the middle, right? So you have to fill in the gap so that the sentence makes sense. So here also you will have to write just a word or a short phrase as it is written here, word or a short phrase or even a number. Again, not like full long sentences, just some phrases you have to fit. All the answers for all these questions you will find definitely in the four texts. Okay, so it does not follow a sequence, it is jumbled up, so any answer can be found in any text, right? So that's why specific information we have to look for in reading part A. And do not change the word when you're writing the answer. No changes in words. Okay, do not grammatically modify it. So if it is singular, it is medication, write medication. If it is medications with an S, you write it with an S. Okay, it needs to be written in the exact same form. If there are any errors in spellings, then your marks will be affected. Okay, so this is all about part A. Any questions so far about part A?
No, ma'am.
Okay, perfect. Now let's move on to part B of reading. Now in part B, there are 6 questions, okay? Only 6 questions are there. For each question, there will be a text, okay? So separately for each question, there is a text. First, the question will be written and then 3 MCQ options are there. So in part B, 3 option MCQs will be there. And then there will be a short text from which you have to find the answer. The text will always be about 100 to 150 words. Okay, not more than that. Now, the kind of texts that are there in part B, these are based on workplace internal communication. So, workplace internal communication means that these texts, as you can see here, it says memo. It could also be an email, it could be a policy document, it could be a notice that is written on the notice board. So, all the things that facilitate communication in the workplace, those kind of texts will be there. So, here it is memo, here it is some sort of assessments, right? And then here it is about medication chart. So nothing about really an illness, nothing about case studies, practical issues and procedures that take place in the workplace. Those are the things that will be there in part B. So here you can see guidelines are there, right? So another important thing to note is that there is no separate answer sheet where you have to write the answers for the whole of reading test. You have to answer within the booklet that is given. In case of these MCQs, so here you can see it is a circle. So you have to shade the correct option. Okay. All right. So this is basically what will be there in part B. 6 questions. Each question will have 3 option MCQs and a text, a short text of about 100 to 150 words. These texts will be about workplace internal communication. Okay. Is part B clear? Any questions?
No, ma'am.
No, ma'am.
No, ma'am.
Okay, perfect. Let's move on to part C. Now, in part C, there will be case studies. So, it is a bit information heavy. So, case studies can be there, or the articles that are published in medical websites. Those kind of things are there in part C. So, 2 long passages will be there in part C. Total number of questions in part C is 16. Okay, they are divided into 2. So, 8 questions for first passage, 8 questions for second passage. Now, as you can see, the title, The Impact of Hospital Design on Dementia Patients. So, again, it's a case study. It includes a lot of studies over here, like, see, the aim of a new study, and then in this study, then a new study will be mentioned. Okay, so a lot of case studies are there, and you will see a lot of perspectives in the passages that are written. So, 8 questions for each passage. There will be 4 option MCQs in reading part C questions. Okay, 4 option MCQs. So 8 questions for each passage. So this is basically the format. So 16 questions are there in part C, 6 questions are there in part B, and 20 questions are there in part A. So total number of questions is 42. In order to score a B or a 350, you need to score 30 or above. So 30 should be your limit, that I have to get 30 questions right at least. Okay? So how many questions do you need to get right to score a 350?
30
30.
questions.
Yes, minimum 30. Okay. All right. So in all of these parts, there are some skills and strategies that we need, right, to answer these questions quickly, especially in part A. So we will start with part A today. So before going on to the skill that we need in part A, I'm going to do an activity with you. Okay. So for that, I will direct you to your Moodle accounts, but first I will share my screen and show you what needs to be done. Okay, let me know when you can see my screen. You can see it?
Yes, ma'am.
Yes,
Okay,
ma'am.
so this is activity 1. It is called prediction. So what you have to do is, in pairs with your partner, you will have to predict what kind of information will be there in each folder. You don't know the contents, you have to guess, you have to predict. Okay, I will give you 3 minutes to do this with your partner. I will send you in breakout rooms shortly. So can somebody tell me, what do we have to do in activity 1?
We have to predict the answers.
Yes, you have to predict what will be there in each folder. How much time do you have for this activity?
3 minutes.
3
3
minutes.
minutes.
Yes, and do you have to do this individually or in pairs?
Pair.
In pairs.
Yes, very good. So I'll send you in the breakout rooms and you have 3 minutes to do this. Okay, you have been invited. Please accept. Yes, somebody asked for help.
Yes, ma'am. There is, ma'am told there is 2 people are there.
Yes, you have another student with you, Gigisha.
Yes, ma'am.
Yes, 2
Okay.
students are there. Okay.
Okay,
All right.
thank you, ma'am.
താഴോട്ട് പോകുന്നുണ്ടോ?
ഇല്ല ഇല്ല ഇല്ല.
പിന്നെ എങ്ങനെ നമ്മൾ ക്വസ്റ്റ്യൻസ് കാണുന്നത്?
അതായത് അത് എന്താന്ന് പ്രെഡിക്റ്റ് ചെയ്യാനല്ലേ പറഞ്ഞത്?
No, predict ചെയ്യാനത്. What kind of
അത്
information?
നമ്മുടെ പ്രഡിക്റ്റ് ചെയ്തതില്ലേ?
ആ
ഇതിനകത്ത് എല്ലാ സ്ഥലത്തില്ലല്ലോ.
ഇല്ല അതിൻ്റെ അകത്തൊന്നും ഇല്ല. നമ്മൾ എന്താണ് predict ചെയ്യുന്നത്? Okay, they may be related to the UK census or how many patients have asthma due to work
Okay.
like that. Okay, the second one
Census
guideline.
in the UK related to asthma. Okay.
Second,
മൂന്നാമത്തത് ഫ്ലോ ചാർട്ട് വരച്ചേക്കാണ്. നമ്മുടെ ഹോസ്പിറ്റൽസിന് എത്ര പേഷ്യൻസിനെയാണ് ആസ്മ കണ്ടുപിടിച്ചിരിക്കുന്നത്, ഡയഗ്നോസ് ചെയ്തിരിക്കുന്നത്. നാലാമത് ആസ്മ ആൻഡ് ഫ്ലൂട്ട് ഷോട്ട്സ്. ആസ്മയുടെ കൂടെ ഫ്ലൂവും കൂടെ വന്നിട്ടുള്ള ആൾക്കാരാന്ന് തോന്നുന്നു.
അതെ അതെ ഇത്ര ഉള്ളല്ലേ.
Hello.
Hi, Anija.
Hi. Hi, ma'am.
Okay, more students are joining. Yes, I'm just waiting for other students to also join. Okay, we are back with a bang. So now we will discuss. So I think you can raise your hands and tell me. So first folder, work-related asthma in the UK. So tell me, what information is there?
Incidents in 2018.
Okay, what more? What else do you think is there in the folder?
Ma'am, introduction and definition maybe.
Okay, good. Others?
Census.
Yes, census can be there. All right, let's talk about the second folder, guidelines for the diagnosis and management of asthma.
Instructions.
Yes.
Instructions to manage and diagnose the condition.
Yes.
Diagnosis and management.
Yes.
Diagnosis and management.
Yes. Diagnosis, management. So guidelines, instructions for that. Yes.
Diagnostic methods for identifying methods.
Yes. Measures and methods. Yes. Let's discuss the third folder, diagnostic flowchart for asthma in clinical practice.
Flow chart.
Flow
chart.
Diagnostic measures.
Different
Yes.
methods.
Diagnostic measures like sputum culture and other tests.
Very good. Yes. Let's look at the last folder, asthma and flu shots.
Medication, ma'am. Treatment, medication.
Medication, treatment. Yes. Anything else?
The prevention.
Yes. Prevention.
Flu vaccination.
Yes. Yes. Good. So one thing that I noticed was that not many of you were conversing in English. You were using your own language, right? So we are preparing for OET, right, which is an English-based test. So let's make a sincere effort to try to talk to our partner in English, okay? Because I know in these classes we might not get much opportunities to communicate, right? And outside the classroom we might not get these opportunities. So let's make a sincere effort that whichever discussion we are doing in whichever module, let's try to talk in English, okay?
Yes, ma'am.
Okay, ma'am. Thank you. Wonderful. Okay, so tell me this, was it helpful? Like if you try to look at the folders, were you able to guess it easily? What was in the folders? Was it easy for you?
Yes, ma'am.
Yes, all of you could get it correctly. So you're making my task harder because you are too good at it. So I'm going to increase the challenge now. Okay. So what I'm going to do is I'm going to send you on a secret mission. Okay. Imagine all of you are secret agents and you have to decipher a document. Okay. But in that documents, only the headings are mentioned. You don't know the contents, right? So what you have to do is you have to look at that document and try to see what information does it contain? So you have to discuss that with your partner and then report back to me. Okay? You will again get 3 minutes for this. All right, you have to do this with your partner. So this is activity 2, prediction 2. If you open that in your Moodle, I will send you in the breakout room. So how much time do you have for this activity?
3 minutes.
3 minutes. And what do you have to report to me?
Headlines. Headlines of the
The headings.
Yes. So 4 texts will be there. There will be headings mentioned there. You have to figure out what is there in the document. Okay. So I will send you in the breakout room. Please join your breakout rooms. Anjali, please join your breakout room. You might be getting a message.
Yes, we can start it. Lead exposure in Australia. Lead exposure.
Yes.
Lead exposure. First one, lead exposure in Australia. Text A. Second, health effects of the lead.
Anjali, please join your breakout room.
Management of individual. That
And
one
how
in
prevent-
section C, no? Management of individual. How we can manage according to the severity. How we can manage.
Then text D is investigating the source of exposure.
Investigating the source of exposure. Investigating
Prevention.
For reducing the elevated blood levels.
That is treatment options
But,
like
treatment
management.
options. Yeah. Yes. Okay. Okay, that's all.
Hello.
Hello. Yeah.
Hello.
Hello. Okay, let's wait for others to join as well. Were you able to communicate in English this time?
Yes.
Yes, ma'am.
Wonderful. It feels good, doesn't it? We are so used to speaking in our own language that we don't make the effort, but we should. Anjali, you are not audible. Your voice is breaking if you're trying to say something. Okay, everyone is back. All right. So were you able to guess what is there in the contents?
Yes, ma'am.
Yes, ma'am.
Okay. So I will nominate, I will say your name and then you have to tell me. Okay. So
Okay,
first
ma'am.
we will discuss text A. All right. So I will pick Sharon. Can you hear me, Sharon?
Yes, ma'am.
Yes. What was there in text A? What did you and your partner discuss?
Maybe an incident of lead exposure
Mm-hmm.
in Australia. That means the content.
Okay. Someone else would like to add anything to this? Okay.
That
Yeah, go on. Okay. So let's discuss text B. So Nina, please answer.
It includes signs and symptoms of after effects of the lead exposure.
Okay. Do you all agree with that?
Yes, ma'am.
yes, ma'am.
Yes, ma'am.
Yes,
Okay.
ma'am.
Now let's talk about text C. Okay. Elsa.
And it might be related to the blood test levels of blood testing
Mm-hmm.
levels.
Okay. Anyone else would like to add anything to that?
The diagnosis and
Diagnostic test and primary care.
management
Yes.
of lead exposure.
Management.
Yes. That is also
Classification.
included.
According
Yes. Yes. Very good. Now the last one, Prabina.
Yes, ma'am.
Please share.
Uh, this one, management of individuals.
Mm-hmm.
And last one is investigating the source of exposure, isn't it, ma'am?
Yes. Go ahead.
For that, they will check out how the lead become leak and what is the cause or what are the thing wrong happened there. They will investigate all the things for exposure and how many that amount of exposure, everything they will investigate.
Okay, perfect. So you were able to guess what is there in the contents based on the headings. So this skill is called skimming. Okay, it is called skimming. This you will use for answering the first set of questions that is there in reading part A. Now let's discuss a little bit in detail what is skimming. So I'm just going to share my screen with you. Okay, can you see my screen?
Yes.
Yes, ma'am.
Yes. So skimming, it says, skimming is reading parts of a text like the title, subheadings, first sentences in paragraph to understand three things. Number one, the author's purpose. Now, when you were reading the document that I just told you to read, you would be able to understand that it was highly about lead exposure. That is what was the main concern, right? Now, second is main idea of the text. And third is to know how the text has been organized or structured. So you could see there are four texts, right? That is how it was structured, right? You could see that just by the headings of it. So why are headings important? Because they will help you to understand that what kind of text will be there. So you don't have to read in depth, but only from reading the headings you will be able to understand that this is what this text contains. Okay, so skimming is like previewing a text by reading the title. So make note of these things that you need to remember. Title we need to make note of. Headings or subheadings that indicate what kind of important ideas will be developed in the text. Then last, charts, pictures, captions, etc. Or phrases that are there in bold or italics. So remember I told you that one of the four texts of reading part A will contain pictures or tabular information. So that also needs to be taken into account. Then also by reading the first few sentences in paragraph, you can understand what is the main idea behind it. Okay, so skimming helps you to predict and anticipate the contents of the text without detailed reading. Okay,
Yes.
all right. So
Okay.
were you able to understand what is skimming?
Yes, ma'am.
Yes, ma'am.
Okay, can somebody repeat it? Okay, should I nominate again? Sobia, can you tell us what is skimming?
Skimming is
skimming is the reading part of a text test, and we can understand in the subheadings and first sentences, and we can predict the what is in this text.
Yes, thank you. Leah Paul, can you please add to whatever she said?
For skimming, we can check. First, we can notice the title and some headings. From this, we will get the idea about that paragraph. Also, from chart, pictures, and table.
Yes.
And from the first sentence of that paragraph, we will get the idea of, about that paragraph. Without reading more about the full paragraph, we will get the idea of that paragraph.
Exactly. So because we need speed in reading part A, that is why we cannot read every detail. That's why we have to understand, we have to read the heading and then we have to guess that, okay, this is the information that this text will contain, and then we can answer the questions in a better way. Okay. So if you have understood what skimming is, I will do one more activity with you. Okay, this is activity 3. So before you go to activity 3, there are two texts that are given in activity 3. One is text A, second is text B. When I send you in breakout rooms, you have to assign an alphabet to each other. So one will be A, another will be B. Okay, now student A will read text A, student B will read text B. You will have 1 minute to read your text separately. Then after 1 minute is over, so student A will tell student B about what was there in her text. Okay. And while she is saying what was there in her text, you can check by looking at text A that whatever she is saying, is that correct or not. Okay. Were you able to understand this? Yeah. So I will give you 4 minutes for this. 1 minute you have to read your own text individually, and for the next like 1 minute you can student A can share. For the next 1 minute, student B can share. And while they're speaking, check if the information they are saying is correct or not. Okay. So how much time do you have for this?
4 minutes.
4 minutes. Not 1 minute. Someone said 1 minute. 4 minutes, 1 minute for individual exercise. Okay, so keep note of the time that for 1 minute only you have to read the text. Now you can open the Moodle. Activity 3 you have to open. Okay. All right, I am starting the rooms.
Hello.
Yes.
Is it raining?
Yeah, tell me.
Okay, I will read text A and you will read text B.
Please join
Hello,
your
Anisha.
rooms.
Okay.
Okay, so you don't have anyone, right? So I will probably do it with you. Okay.
Okay,
So
ma'am.
you can look at text A and I
Okay.
will look at text B.
Okay, ma'am.
You can continue reading it. I'll be back.
Okay, ma'am.
Did you gone through?
Yes.
Yeah, for text A, what they told?
They told there is
Not verified the substance in the workplace. Then it is also called as it is also work-related asthma, and it includes what it.
Yes, so have you read your text?
Yes, ma'am.
Okay, tell me, what did you find in that text?
Text A, it's about work-related asthma in the UK in 2018.
Mm-hmm.
There is a study. So that there is no specified definition
Mm-hmm.
about occupational asthma. The what is occupational asthma means uh, work related, that is also called as work related asthma because of the working environment, some causative agents, it may affect and it may cause asthma to you sometimes. If the person may have asthma and some environmental factors in the workplace, it will triggers the symptoms like exposure to a respiratory sensitizer in the workplace. It may also trigger the asthma. That is work-related asthma. Mainly the asthma, the person may affect with the asthma because of factor in the workplace.
Okay, perfect. Thank you.
Okay.
So in text B, there were a lot of things. Number one was that it was about long-term effects of medication for the management of like persistent asthma. And then there were also some things about how we can check the severity of asthma, like how, the duration of it and how severe it is, and also the future risk. Then also there were some things about the action plans that can be taken for the people who have asthma, and how we can control, check asthma control, that how much of it is being, how much are we able to control it, how much are we able to not control the symptoms and signs of asthma. And then there was about follow-up visit, that we have to plan follow-up visits at periodical intervals, so that we are able to keep monitor the patient that is there.
Okay.
Okay.
Yes,
All
ma'am.
right. Perfect. So
Thank you, ma'am.
yes, I'll be back. Thank you, Marina.
Thank you, ma'am.
I'm in Palakkad. You are Nisha? Kollam, which place? Which place is okay? Because no, I myself my native is Punalur. That's why. Okay.
Okay, everyone is back. So I have some questions for you regarding the activity that you just did. Can you just show, like a show of hands, how many of you had text A? Okay, all right. So, Anju, I'm going to ask you that when you were listening to the text B explanation of your partner, so when you were checking information, was it easy for you, or was it a bit hard to keep track of what she's saying?
No, it is very easy to me.
Okay. All right. Now tell me, how many of you had text B? Okay. Aswati, I'm going to ask you. So when you were checking information of your partner who was speaking text A, were you able to easily check that is she saying the correct thing or not?
Yes, ma'am. I understood what she's saying.
Okay. Others who had the same thing. So the ones who had text B, raise of hand again. Was there anyone who found it hard to follow what the other person was saying by looking at their text?
No, ma'am.
No, ma'am.
Okay. Okay, great. So, the basic thing why I did this activity with you is that if you look at text A, there were no headings, right? But in text B, there were a lot of headings and subheadings. So when you check information that whatever she is saying, it is there or not, so it is sometimes easier for a text with subheadings to, see what kind of information is there. But if there are no headings, it's very hard to understand, to predict what information will be there, right? So that is why this activity was there, to show you two samples, that in text A, no headings are there. In text B, a lot of headings are there. So that makes our task easier. Okay? All right. So I asked you a question. I'm going to ask you a question. So the first set of questions in reading part A, what is that set called?
Matching questions.
Matching questions.
Yes,
Matching questions.
exactly. Matching questions. So this skill of skimming, where you predict by looking at the headings, is used in the matching questions, the first 7 questions that are there in reading part A. Okay. So now, again, you will do some questions which are based on your exam, which will be activity number 4. You will do that with your partner. You will have 4 minutes to do that. You have to answer. 1 second, I'll share my screen and show you what you have to do. Can you see my screen yet?
Yes, ma'am.
Yes.
Yes,
So
ma'am.
there are 4
Yeah.
texts, text A, B, C, and D. Now this is how you will get it in the exam as well. But to make it just a little bit easier, there is a question with each text. So you have to answer that by looking at the text. Okay. So I will send you in breakout rooms. You have 4 to 5 minutes to do this activity. Okay, answer the question, write the answer within the space that is given. So you can write a short phrase or a word. Okay, so what kind of answer do you have to give?
Short
Short
phrase or a way.
forward.
Yes, so write the
Phrase.
entire phrase, whichever you find suitable. And how much time do you have for this?
4 to 5
5
minutes.
minutes.
45
Yes,
minutes.
4 to 5 minutes. And you have to do it in pairs. So I will again send you in the breakout rooms. But right now, I think your partners will be changed. So, activity 4. Please join your breakout rooms.
Hello?
Yes, yes, Anjali.
These are the questions. Medications used for
Anjali, please accept the request of breakout rooms.
Yes.
Yes.
African or Caribbean descent. ESCENT. Okay. Next question. Controlling high blood pressure. Advise patients to stop smoking. Okay. What is the question? Look in the text.
Lifestyle changes.
Finished.
Yes. Exercises. I think it's plural. Exercises. SES is there.
Yes. Okay.
Okay. Then text C. The following are indicators of high blood pressure.
Yes, significant reduction in heart attack and stroke, right? Not heart attack, heart disease.
Heart diseases and stroke.
Systolic pressure of 85 mm.
Which category of blood pressure in diastolic pressure?
Pre-hypertension. Diastolic, no? Pre-hypertension, 80 to 89, no? So 85 will be in the pre-hypertension.
Yeah, diastolic pressure. Find a matter of blood pressure. Diastolic belongs to pre-hypertension.
Yeah, pre-hypertension. So we will move to next.
Okay, pre-hypertension.
Pre-hypertension.
85 because I'm not doing blood pressure. 85 mm of
Submit all and finish.
yes.
Yes. It's my network connection is a little bit slow. That's it. You. Loading for me. So
Okay. Welcome back. So how was this task?
Easy, ma'am.
Difficult.
It's easy, ma'am.
Yeah. So the ones that are difficult, was it difficult because of the time?
No, we missed some of the words there.
Typing mistake, ma'am. typing.
Me also.
We are not some are not familiar with the typing in the computer like that.
Okay. So did you all submit and finish? Like
Yes, ma'am.
submit.
Yes, ma'am.
So how many questions did you get right?
2.
Two.
Three.
Three, ma'am. Three.
Three, ma'am.
Okay. So I will share the screen and let's discuss the questions and their answers. Okay. So can you see the screen?
Yes, ma'am.
Yes, ma'am.
All right. So let's discuss text
Yes.
A. Look in text A to find who has an increased risk of blood pressure. Remya, can you please answer this question?
Yeah. Um, that is I write it, black patients of African or Caribbean descent.
Okay. Did anyone else have a different answer?
No, ma'am.
No, ma'am.
No, ma'am.
Okay. So I think text A, everyone got this right.
Yes.
Okay. Let's move on to text B. So in text B, look in the text B to find what type of exercise patients should do 2 times each week. So, Rajita, could you please answer?
Strengthen exercise that I wrote.
Okay. Everyone else, did you have this same one?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes, ma'am. Yes.
Okay. So here, including
Strength.
strength exercises at least 2 days per week. Yes. Okay.
Yes.
Then let's look at text C. So look in text C to find what would happen if patients with high blood pressure made an effort to lower it. So Sharon, please answer.
Significant reduction in the incidence of heart disease and stroke.
Okay. Did everyone else also have the same answer?
Yes,
We
ma'am.
missed
Yes,
the
ma'am.
word significant.
Sorry?
We,
Significant we missed.
We wrote only reduction in high blood pressure like that. Some words are missing, ma'am.
Ah, right. Yeah, so you need to include
Me also,
significant
ma'am.
as well.
yes.
Okay. So let's look at the next question. Text D. So look in text D to find which category of blood pressure diastolic pressure of 85 mmHg would belong to. So Marina, could you please answer this?
Pre-hypertension.
Sorry?
Pre-hypertension.
Pre-hypertension, did everyone have this answer? So
Yes.
Yes, ma'am.
why? Because it falls in this category. It says
Category.
85, right?
Yeah.
And diastolic pressure. So this and this. So that is why it is pre-hypertension.
Right.
Okay. So yes, this was the task. All right. Now we will do one more activity, which will be more like an exam. Okay. Like you get the questions in the exam. We will now do matching questions. Okay. You will have 4 texts and the questions will not be followed by the text. So this one was easy. The difficult task is coming now. Okay. And you have to do this individually because in the exam we have to do this individually. I will give you about 7 to 8 minutes to do the next task. You have to go through all the 4 texts. Questions can be jumbled up. Options you have to select. Okay, text A, B, C, or D. In which text you will find the information. So once you go there, you have to select the option that is written over there. Okay, 7 to 8 minutes I will give each of you. It is activity number 5. Okay, how much time do you have?
7 to
7 to
8
8.
minutes.
Okay, and do you have to do this in pairs?
No.
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 It's do it
Okay, all right.
individually.
Great. So now please open your open your Moodle. Switch off your cameras. Please mute yourself and focus for 7, 8 minutes just to answer those questions. Is everyone done?
Yes, ma'am. Yes, ma'am.
Okay, just one more minute. Okay, everyone, please come back to the class. We will discuss the answers. Please return to the class. Your time is over. I gave you some extra minutes. Okay, so how was the task? Easy, difficult, medium?
Difficult.
Medium.
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 Okay. Did you use the skill of skimming? Did you find answers with the subheadings or headings?
Yes,
Yes,
ma'am.
Yes,
ma'am.
ma'am.
Okay, good. So did you all submit
Yes, ma'am.
your
Yes,
answer?
Yes, ma'am.
So what was the score?
10.
Others? I just got one answer.
5 out of 10.
Okay. Others?
8.75.
7.
8.55.
Okay. All right. Okay. All right. So now we will discuss the answers of each and every question. So I will share my screen and we will try to find the answer. I hope you remember in which text you found the answer because I'm going to ask you some questions about that. Okay. All right. So the first question was UTI symptoms in different age groups. In which text did you find information?
A, ma'am.
A.
Text A.
A? Everyone says A?
Yeah.
Yes.
Yes, ma'am.
Okay. Can you tell me where in A you found that information?
On the first, this.
Common symptoms.
Infants in
Less
Infants and
Infants are younger than 3 months in the 3
Yes.
months old.
Exactly. So by looking at these subheadings, you were able to see that the different age groups basically, right?
Yeah.
So
Yes,
I hope everyone is clear about the first question.
Yes, ma'am.
yes, ma'am.
Okay. Let's look at the second question. In which text can you find information about appropriate actions following the outcomes of test results? So what was the correct answer here?
Text
B.
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 Did anyone else have a different answer other than B?
Yes. C.
C? Someone said C?
I got wrong.
Okay. So in B, can you tell me where you found the answer for this? Appropriate actions following the outcome of test results. So where did you find the
B.
information about it?
In the last part, there is leukocyte.
Uh-huh.
There is in that
Negative. Do not
treatment of
So in these
that
bullet
part.
points.
Yeah.
Okay. Yes, correct. Do you all agree? This is where you found the information?
Yes, ma'am.
Yes, ma'am.
Okay, perfect. Now let's look at the third question. Typical medications used for different forms of UTI.
D.
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 Did someone have a different answer than D?
No.
No, ma'am.
Antibiotic.
It is clear, ma'am.
Okay. So where did you find it in D?
In the
Antibiotic.
first heading,
Antibiotics
pharmacological
commonly used to
management of
treat
antibiotics.
This statement right here, this heading?
Yeah.
Yes, correct. Now let's look at question number 4. Testing options following diagnosis of a UTI.
C.
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 Did everyone answer C?
No,
Yes.
ma'am.
no, ma'am.
Yeah, what else did you answer? What did you answer, Remya, Nina?
B.
B. Okay. So, where did you think that the answer lies there? Could you tell me where you located it in text B? Because this is for your understanding only.
Text B is diagnosis of urinary tract infection. Then after that, text C, there is a other options like ultrasound.
So the ones who answered text B, Marina, did you also answer B?
No, C.
Okay, so the ones who answered B, I was asking you that which information made you choose B?
Urine
Where?
testing.
Yeah, Rajita?
Urine testing. From
Okay, so testing options were written. Testing options following a diagnosis of a UTI. That's why you thought this is correct. Okay. So why do you think, why did others not choose this? Tell me. B is not correct, right? So why is it not correct? She gave a very valid reason.
Because in text C, it is clearly mentioned about the diagnostic measures,
Right.
ultrasound,
Mm-hmm.
and the scanning, and diagnostic test. Different diagnostic tests are there. So we thought that is
That is optional.
Yes, yes, very good. So here it is written clearly which testing is mentioned, right? That is just a heading of urine testing, but for UTI, it is written over here, like you correctly pointed out. Okay, so yes, the correct answer was C. Now let's look at the next question. Question number 5. Potential side effects of a UTI medication.
D, ma'am.
D, ma'am. It is clear, ma'am.
D or B?
D.
D.
B. Okay, the ones who said B. Let's go back to text B. Yes. Where did you find information about side effects of UTI medication?
Not B, ma'am. Actually, D. All
D,
said
D.
D.
So
A, B, C, D.
someone said B. So I'm asking them. Did anyone answer B? I heard some B's. Okay, because I thought I heard someone say B. So just for clarification of your doubt, I refer to that. But other than that, yes, the answer was D. So where can you find the side effects?
Common
adverse effects.
Yes, this particular heading made you decide, right? Great. Okay, then number 6. When to start medication for a UTI? What was the answer?
B.
B.
B or D? Someone said D.
B.
I need to get my ears tested. Okay, so where can you find it in B?
In the B, the second paragraph, start antibiotic for UTI. Only start antibiotic treatment if for UTI if there is a good clinical evidence like that.
This one or this one you're talking about, right?
Yes, ma'am.
Okay, others, did you also find the answer here or somewhere else?
Second line, ma'am.
This one?
Yes, ma'am.
Yes, ma'am.
Okay, yes, correct. That's correct. So yes, it is text B. Now let's come to the last one. Medication options for different forms of UTI.
D.
Text D.
Okay, let's see. Where in text D can you find information about that? Different forms of UTI?
Medication.
Antibiotics.
Yes.
Trimethophan, then
antibiotics.
reflexin.
Yes.
Are names of antibiotics.
Then
Yes.
lower UTI and upper UTI medications.
Yes. So, yes, this is the right option. because all the different names of the medications are written. Okay, so maximum of the questions that you answered were from the headings. So that is why the first set of questions that you have, which is matching questions, that's where this skill is useful. That not always do you have to look at the details. Sometimes just by looking at the headings you can easily identify the answer. Okay, all right, so is everyone clear about the skill of skimming?
Yes,
Yes,
ma'am.
Yes.
ma'am.
Okay. So this is what today's class was basically about. I will post another quiz very soon, which will be a homework for you. Okay. Just like this one, I will post another one, so you can take your time in answering that. And in the next class, maybe we can discuss that as well. Okay. Will that be fine?
Okay.
Okay. Perfect. Any
Ma'am.
questions so far about anything in the class?
No, ma'am.
No, ma'am.
Okay, great. So I think our next class will be on Thursday. I think it's Christmas Eve, right?
Yes.
I was hoping our class would be on Christmas. We could all wear red or something. Okay. Do you think we can do that on Thursday? Let's all color code.
Okay, ma'am.
Oh, ma'am.
Yes, no. Do you think we can do that? Let's all wear
No.
red.
Yeah.
Yes?
Yes,
Let's
ma'am.
have some fun in the class, because if you were sitting in front of me, I know this online thing, it kind of creates a distance, but like doing these things, we can actually feel like a team, right? That we are doing something amazing. So that's why
Ma'am, I
just,
can't.
okay.
Yeah, also, ma'am.
Okay, not a problem. So I think I will see you all on Thursday. And if you have any questions, you can text me up. I will send a message again in the group. Any questions about it, you can do that. And the homework that you have to do, I will post that soon. There is one video that is posted in Moodle, which is about if you give OET exam on a computer. So I will just share the screen with you and show you that. Okay, so this particular video, OET reading on computer. So please watch this video in your own time. Okay?
Yes,
Okay,
ma'am.
ma'am.
All right, perfect. So this is all. Again, if you have any doubts, you can always hit me up later. Okay, so that is it for this class. Thank you so much, everyone, for being so participative in this class. I hope you enjoyed it, and I'll see you again soon. Thank you.
Thank you,
Thank
ma'am.
you, ma'am.
Thank you,
Thank you,
ma'am.
ma'am.
Thank you. Bye bye.
Thank you,
Bye,
ma'am.
ma'am.
Thank you.